Oh my gosh, hello you guys. I am back. I'm still alive, and as you can tell by the title of today's video, I had brain surgery, and today I'm gonna tell you all about it. I'm gonna give you a story time and tell you my experience and about my 5-day stay in the hospital and the ICU, and it's just gonna be a fun and lit time. So sit down, grab like a drink and a snack, because this is probably gonna be one of the longer videos on my channel. I'm gonna try to cap it at 20 minutes. No promises though. And let's just try to like hit all the high points of the story, because 5 days in the hospital, there's a lot of content to cover in that, but I'm gonna try to keep it short and condensed just so that it doesn't get boring. But before we get started, hi, I'm Tiana. I used to have a brain tumor. Now I don't. It was benign though, so I don't have cancer or anything. Thank God for that. And if you want more information on all of my medical stuff, in case you are looking at this video because you are going through something similar, then I will make a little playlist and additionally link information and resources below, and I'll link my other former videos below. I think I have like maybe 5 or 6 related to this topic where I got like diagnosed and a bunch of stuff. But anyways, today is February 26th and my surgery was February 17th, so we're about 9 days out. So 9 days away from brain surgery, and this is what I look like. Obviously it was not a craniotomy. I had transsphenoidal endoscopic brain surgery because I had a pituitary adenoma. I had a pituitary microadenoma, and they removed that through my nose. So transsphenoidal endoscopic surgery is where they basically go through your nose, they break through like the bones and stuff, and your pituitary gland is like back here, and it's minimally invasive. Honestly, of all of the brain tumors to get, I got this is like a horrible thing to say, but of all the brain tumors to get, I got the best one. Actually, you know what, that's I don't even want to be saying that, but I got the one that is removed in the least invasive way. That's a better way to put it. And also mine was not cancerous. However, mine was secreting IGF-1 growth hormone. So had they not found out, then I could have developed a condition called acromegaly, where basically my organs could have gotten messed up and I could have basically died. So, you know how it is. But some people get acromegaly from having a pituitary tumor. Some people have just a benign tumor that is silent or non-secreting. And then some people have ones that secrete like prolactin, and then they like have other hormonal issues. Like basically all brain tumors are bad. Mine just happened to be non-cancerous, and the cure rate for mine with the surgery that I had is 70 to 80% for microadenomas. For macroadenomas, which are a little bit bigger, I think the cure rate is a little bit less successful, but I'm a positive person, so I know that I'm gonna be fine. And hopefully this will be the last brain tumor related video that I ever have to make. But that is a little overview of the surgery that I had, in case you guys were curious. Now I'm gonna go ahead and get into what exactly happened. So basically, for a while we didn't know that my tumor was the cause of my migraines, because I went to a super shitty neurologist that I really don't have any respect for. And that was the first neurologist I ever went to. And then we got a second opinion from an actually good neurologist, and he ran more extensive tests and he referred me to more people, and he actually ordered an MRI of the nerves in my brain, and he found out that the tumor was actually in my sinus cavity or whatever. And that's why I was getting such bad headaches, is because my brain couldn't regulate its pressure basically, so I was getting really bad pressure buildup headaches from the tumor. Even though it was really small, the place that it was very, very bad, just because of like the way that your brain is built. Like I couldn't regulate the pressure in my brain, so I was getting headaches, and I was on like a ton of medicine, and that's not like really sustainable or healthy. So in addition to the pain, the hormonal stuff from the endocrinologist came back, and then the neurosurgeon scheduled the surgery. And then basically the neurosurgeon has to work with an ear, nose, and throat doctor called an ENT, and that person is who basically helps cut open your nose and sew it back together. So I went to a couple pre-op appointments with him, and after that, basically your surgery is scheduled. So I think it took about a month for it to get scheduled. I remember, yeah, so I had a neurosurgeon appointment January 12th, and then his office scheduled my surgery for February 17th. And now I'm gonna get into like the night before the surgery, the day of, and my stay in the hospital and all of that. So I remember the night before the surgery, I was like super anxious. I worked out and then I ate dinner. I had to stop eating by 12 midnight, and I was trying to go to sleep. I couldn't sleep. I had to take sleeping pills, and I got to the hospital at like 5 a.m. Even though my surgery was at 7, you have to arrive 2 hours early. So I got there at 5 a.m. They take you into a little hospital waiting room basically, and you have to wipe your body down with like disinfectant wipes. They give you a COVID test, they draw your blood, they check your vitals, basically do a bunch of stuff. You have to put on the gown and the socks. And I remember an anesthesiologist came by, a couple nurses came by, the ENT came by, and oh my gosh, the doctor or the neurosurgeon was running late actually, and I didn't get to see him before my surgery, but I didn't really care because I'd already seen him like so many times. But they started my IV in that little hospital waiting room, and it was just basically an IV with, I think one of the nurses said that basically Gatorade was in my IV, because I'm the type of patient that's a little bit annoying, and I always ask what is that whenever they're injecting me with stuff, just because I want to know. And I always ask like, is this gonna hurt, or you know, what is this, what is that? And basically they said it's Gatorade in the IV. That's literally what the nurse said. She said it'll make you feel like you drank Gatorade. So they put that in my IV while I was in the little hospital waiting room. And then after the doctors came by, she said, we're gonna put something in there that's gonna make you basically relax and calm down. So she put that in my IV, and then they wheeled me from the pre-surgery room into the operating room. And then the last thing that I remember was her telling me to go from the pre-operating bed to like the operating table. And then after that I like literally passed out. And then I woke up and I was in the ICU, and I was screaming, crying, and then later throwing up. And I woke up in the ICU, and all I remember is saying my head hurts so bad. And it wasn't even the migraine headaches like what I used to get. It was basically, I guess, a trauma-induced headache from the operation, because even though it's a minimally invasive surgical procedure, they still use a small drill and an endoscope, and like they're shoving stuff up your nose. And I was basically just like, my head hurts, and I was crying, and they told me basically stop crying, because if you cry it's gonna make it worse. So that's what happened in the ICU the first day. I was in the ICU for basically 2 days. I was in the hospital for 5, and when I woke up in the ICU, they ask you, how bad does it hurt on a scale of 1 to 10? And I was like 8 or 9, 8 or 9. And then when I said that, they started injecting me with, I think, fentanyl, and they gave me hydrocodone, and they basically cycle you through different pain medications to see what works and what doesn't, and they try to have you rank like how much did that help. And I was like not really fully there, so I was like, I don't know. I was just kind of like, oh my god, like I don't know. And then we found out that I was allergic, I guess, to fentanyl, or that it makes me throw up, at least makes me nauseous, because when my surgeon visited me, this was embarrassing for me, but he visited to make sure I was okay and just inform us about the procedure and how well it went, which I'll get into in a little bit. But I threw up on the floor in front of him. Like, I sat up from my bed and I was like, I'm gonna throw up, and the nurses couldn't like rush over to me fast enough, but I literally threw up on the ground. And my dad, he literally got grossed out and he had to leave the room. It was super funny. But I was so embarrassed, but everyone was like, oh, it's okay, like you literally just had like probably the worst day of your life, like you're fine. Oh my god, that's what happened. But basically, this is how the procedure went. So my tumor basically was able to be removed without damaging anything in my brain. The ENT told my mom that they basically scooped it out, which is super funny. I wasn't really cognitively able to comprehend all the conversations that the doctors had with my family, because I was on multiple pain medications at once, but it went really well. And I know that it went well because I'm 9 days out and I look like this and I feel so good. I'm not on any pain medication right now. I haven't been on any pain medication since I left the hospital. The day that I left the hospital, I took a couple of like the narcotic pills they gave me because I accidentally took too many Tylenol in one day. And when you take too many Tylenol in one day, you can actually make your headache a lot worse. So be careful of doing that in case you have like a headache or something. Ever since my surgery, I've been doing so much better. And that's just crazy to me because my first neurologist said that I probably didn't need surgery because my tumor was very small. And that just goes to show you the doctors are literally just people. And if you ever have second thoughts, get a second opinion, because they are people and they make mistakes. I really hate my first neurologist because I was in so much pain and he didn't do anything about it. Like, I don't respect that man at all. I don't like his practice. Now that I'm feeling better, my quality of life has improved a lot. My mom said that my face was like super puffy the first day, but by the second day it had already gone down a lot, and like I know that I looked normal by probably the third day. I lost a lot of weight in the hospital, over 10 pounds, because I wasn't eating, not because of anything other than the fact that I was on so much medicine that, one, I was sleeping all day, and two, I just, like, you're not gonna have an appetite after you have brain surgery. And I'm the type of person where if I'm not working out and my body is kind of just at rest, I don't really get super hungry. I think that's just like how I am. Like I just don't really get that hungry because I'm not really using that much energy. But I lost a bunch of weight, and then also part of that was I came off of propranolol, which was one of my migraine meds, and I think that makes you retain water. But since my tumor was removed without damaging anything in my brain, like I remember my neurosurgeon said that my entire pituitary gland is still there. My body is still able to regulate itself because they were drawing my blood and running tests on like my urine and stuff, and all of my labs were coming back really well. He said that on patients who lose a lot of their pituitary gland, basically they're like losing all of their electrolytes through their urine and stuff, and that wasn't happening with me. So I'm literally so thankful to God that my brain was able to just, you know, like the tumor came out and my brain is still fine. Like that's literally the biggest blessing out of this whole thing, and that my head doesn't hurt anymore. I'm so lucky. But the other thing that I want to say is, if you go back on my channel, I thought that my head was hurting because of my birth control. Like the headaches and everything kind of aligned with me switching brands of birth control pills and everything. And different doctors said different things about it. Some of them said it doesn't have anything to do with it, and then some of them said it may not be safe, but you have to get opinions from other types of doctors like endocrinologists and stuff. And then when I talked to my endocrinologist, she didn't give me a definite answer. She actually changed the topic, and she said that she doesn't know if it made the tumor appear, but she had a patient have a stroke from birth control. So I literally don't know if this was just a random occurrence or if it had anything to do with birth control pills or whatever, but all I know personally is that I had a tumor on a part of my brain that regulates all of my body's hormones, and for several years of my life I was on a hormonal contraceptive. So I personally will say that I will never be taking hormonal contraceptives again, because I can't put my body through another brain surgery, and God forbid that the tumor grow back. I can't go through that again ever. So I'm gonna do everything in my power to make sure that I stay healthy, and I'm just like really, really lucky, honestly, because looking back, this was pretty scary, but in the moment I wasn't scared. I was just relieved. But being in the hospital for 5 days was not fun, let me tell you, because when you're in the hospital, you don't get to just chill and be left alone. You're constantly being woken up and just like poked and prodded. I still have all these needle marks on my arm that are healing, on both arms actually, because I had 2 IVs, and when you're in there for brain surgery, you're being injected with a lot of different medications other than pain medicine. I was getting a steroid every day to make sure that my brain didn't swell, and then 2 different antibiotics. And then I remember on one of the days, I think it was the 3rd day, they had to switch out my IVs because my veins were hurting. And I was complaining to the nurses that the medicine was starting to hurt my veins, and for a while they didn't do anything about it until I started crying because that's how bad it hurt. And that was by far like the worst thing ever. So, oh my God, like I don't even, ugh. that was literally disgusting. But other than that, I would say my experience was overall pretty positive. The other thing that really bothered me was when the ENT came by on like the second day when I was in the ICU, and he had to remove, there was like this cotton stuff in my nose to stop the bleeding, I guess. And he didn't tell me what he was doing, which is probably good on his part, because if he had told me, I probably would have started crying and freaking out, because I don't like the ENT, because every time I go to his office, they have to like look up my nose and it makes me uncomfortable. But he basically like came up to me and he was like, oh, I need to take a look in your nose. And I thought he was just looking, and then all of a sudden he like pulls this thing out of my nose and it looks like a tampon, and it was just like cotton. It was so uncomfortable. But he took that out of my nose and that was very uncomfortable. But those were by far the most uncomfortable things. The cotton, and then all of the IVs and medication, and they're constantly like taking my blood pressure, and they had to draw my blood and do my labs and stuff. That was really annoying. So that is pretty much it for my experience actually in the hospital. Now I'm gonna kind of get into how I'm feeling now. Now that I'm home, I have honestly been feeling better than ever. Waking up in my own bed has been amazing, because I was getting so sick of being in the hospital, because I don't like having my blood drawn and being poked and stuff. Like, I don't want to be around, I don't like being touched anymore, basically. I don't want other people around me. But I'm on so much less medication, which is amazing. My energy levels are pretty good. I'm feeling really good. My head doesn't hurt that much. I'd say my pain tolerance has definitely gone up just from this whole experience. And the only negatives I would say are I can't work out for 6 weeks because I can't strain myself, because I have stitches and packing in my nose and brain, I guess. I don't really know. And then I can't drink from a straw for a couple more weeks, and I can't blow my nose, or I can blow my nose but lightly. So honestly, I would rather just not blow my nose. And they said if I sneeze, to sneeze with my mouth open, but I just haven't had to sneeze. And if I ever feel the need to sneeze, I just don't. Like, I don't know. My allergies haven't really been bothering me, but that has pretty much been it. I haven't had any nosebleeds since I've left the hospital, because they gave me Afrin in the hospital to stop the nosebleeds, and it still stopped it. Like, it hasn't come back. But when I was in the hospital, my nose was bleeding a lot on days 1, 2, and kind of day 3, but it went away. And I feel like I definitely had really good surgeons. Like, my ENT and my neurosurgeon were really, really good. They were highly recommended. I looked up their reviews, honestly, and people had amazing things to say about them. And even my neurosurgeon said that on my post-op MRI that I did, yeah, you do an MRI the day after your surgery. He said that the tumor was completely gone. He said there might be microscopic pieces, but he said from looking at the MRI, even though the area is still inflamed, he didn't see any tumor left. So that's really good. I had an overwhelmingly positive experience. There are risks associated with the surgery that you can read up on. I didn't have any of those complications, like a spinal fluid leak or, you know, like blindness. And that is due to the fact that my tumor was really small, and also that I'm very young, and that I'm also extremely healthy. But overall, I'm just very thankful, and I'm very blessed, and I'm very lucky. I am just glad that I can put this all behind me. That's pretty much it for today's video. So don't forget to like, comment, and subscribe. Make sure to ask any questions that you want answered if I didn't address them down below so that I can comment and get back to you guys. And I'm gonna do my best to link additional information and my additional videos in the description box down below for you guys as well. But that is all for today, so I will see you next time.